So the next sub-skill here is to restore this is still on skill 5, going to the next section, where we restore compliance to 0.04, 40 mils per centimeter water pressure, and take a baseline. So notice our volumes again are back up to around 570, 560, and things are looking pretty good, right? We don't have auto peak, we don't have anything bad going on at this moment, except for maybe too much volume, which we'd have to evaluate as we discussed before. So I'm going to disconnect the circuit and change our raw now to 50 as requested. So there we go. And I'll reset our disconnect alarm. And now, watch what happens. So let's just look at our reset apnea ventilation. So we are in SIMV. Our raw is now 50. Everything else is as set. So you can see now that that our volume has taken quite a hit, right? We've gone from about 570 or so down to 380, 390. And then it says to trigger the ventilator, right, at about a rate of 25. So let's start doing that. I'm having a hard time triggering this vent. Why would that be, do you think? Why is it hard to trigger now? So you notice my respiratory rate's coming up. So we're getting there. But notice what's happening when I trigger a breath. You see a huge dip in the pressure curve, right? Because we have lots of auto peep. I am trying to draw through all this. Because there's so much resistance, it takes a long time for gas to come out of the patient's lungs. You can see I'm finally up to a rate of 25. And notice my tidal volume is still in the 300s, but in the spontaneous breaths, man, I'm working hard to get that 150, 200 mils. Machine breaths, we're getting up to the 300 some. Spontaneous, oh my goodness, 96, 100, I'm getting tired. So think of your patients. If I'm working this hard with the big muscles of my arm, think of the patient who's exhausted, who's compromised, which is why they're on the vent. And here they are having to work this hard to try and trigger breaths.